Got it on? Okay. Hi, Professor Powell. I'm going to be doing my head to toe assessment, bedside assessment. I'm going to go ahead and get started. For the pre-intro, the patient has no fall precautions, no ambulatory aid. There is no known allergies to any kind of medication. The only allergies described are seasonal allergies. So that being said, I'm going to go ahead and begin the assessment.
Hello.
Hi, I'm Scott. I'm going to be your student nurse today, and we're going to be doing head-to-toe assessment. And what brings you in today?
Just a routine checkup.
Just a routine checkup. Can I have your name and date of birth?
Kayla, 04/24/1993.
Okay. Just gonna get some of this. All right. Is there anything in particular that you're coming in for?
No.
No. Okay. Just like a routine. All right. We're gonna start with some vital signs, and then we're gonna go from there, and we're gonna do some other observations and a few other tests. As I said, it's a head-to-toe assessment. Do you have any questions?
No.
Okay. I'm gonna start with. We're gonna do temperature first. I'm just gonna have you stick this underneath your tongue. You got it. Alright, I'm just gonna hold that there. Give it a minute. Also, I don't have a pulse ox, so I could also be doing pulse ox at the same time as temperature. But normal range for pulse ox is between 95% and 100% oxygen saturation. Temperature's still going up. Alright, temperature is at 98 even. I'm just going to put this off to the side over here. Alright, I'm just going to take your, I'm just going to check your pulse, and I'm going to do this for 30 seconds, and then I'll just multiply by 2. Alright, you just relax this arm for me. Okay, pulse is 64 beats per minute, and then I was also counting respirations. Respirations is at 14 a minute. Both of those are in normal ranges. All right, we're gonna take your blood pressure now. And I'm going to use your left arm. Is that okay?
Mm-hmm.
Okay. All right, go ahead and relax this arm for me. Just going to take your pulse here. Alright, go ahead and relax that arm. Alright. I'm going to do a two-step blood pressure. First, I'm going to inflate this cuff, and I'm going to be feeling for when I can no longer feel your pulse in your arm. So at about 120. I'm gonna give her a little bit of time. Normally you'd wait at least 30 seconds. Give the arm a minute to resaturate with blood. Alright, relax that arm for me. And I'm gonna fill 30 30 milligrams of mercury past 120, which is where I no longer felt her pulse in the first step. Alright, blood pressure is 116 over 74, and that's the normal range. Alright. I'm gonna come back over to this side here. Alright, we're gonna be moving on into the assessment, and just looking at your skin. Your skin is normal. You don't look like you have any kind of jaundice. You don't look cyanotic. And I'm just going to feel your skin. I'm just going to check for temperature. Your skin's warm to the touch, not cold. And I'm also going to check your skin turgor. It's just checking for like hydration. You could also check for like circulation. And you have very good skin turgor. I'm also going to check your capillary refill. I can check on your hand. And that's in. And you have good capillary refill on your hand. And I'm going to check down here by your ankle. You have good capillary refill in your ankle as well. As long as I'm down here, I'm going to just test your dorsal pedal pulses. I'm going to check also your posterior tibial pulses. And that's good, because I can feel those pulses, and if I wasn't able to feel those pulses, I could also check behind the knees, towards the end of the thigh, or, and again, I can check your radial pulses. But everything checks out there. So I'm going to give you a set of numbers, and I'm going to have you recall them. I'm going to have you say them out loud, and then I'm going to have you recall them later. The numbers are 2, 4, 6, 8, 10, 2, 4.
2, 4, 6, 8, 10, 2, 4.
Okay. And could you give me the date and the time?
April 3rd and 8 o'clock.
Okay. Do you know what city you're in?
Greenfield.
Okay. Greenfield. Okay. One other thing with skin, I'm just going to also assess your mucosal glands. So could I have you remove your glasses? I also want some sanitizer for this. Have you seen the dermatologist at all in the past?
No.
Okay. Any plans to see the dermatologist?
Yes.
Okay. Alright, let me know if there's any pain, okay? I'm just going to gently palpate your sinuses and just let me know if there's any pain or discomfort, okay? Any pain there?
No.
No? What there?
No.
What there?
No.
Alright. Just go ahead, open your mouth and say ah for me. Okay. Alright, that one checks out too. So what were those numbers I gave you?
2, 4, 6, 8, 10, 2, 4.
Okay. And also just observing, I noticed that you're well groomed and your mood and your affects are appropriate. You're responding to my questions appropriately, which is a good thing. Obviously, you can hear me. Can you hear the gentle rubbing of my fingers on either side of your ear?
Yes.
Okay, that's good. Again, you're appropriately groomed, appropriately dressed. I observed, like when you walked into the room, that your gait is also good. Don't have any kind of limp. Do you have any kind of pain with your joints or any kind of inflammation?
No.
Any kind of crunching? Okay. Yeah. Didn't appear like you would have had any pain. So, all right. For some of the rest of the assessment, we're also going to be doing some musculoskeletal, some respiratory, some cardiovascular, as well as some GI and GU questions, and just we'll be listening to a few stomach sounds, heart sounds, lung sounds, and we'll take it from there. Could I have you look back and swallow? Okay, I'm just assessing for thyroid, any kind of enlargement, making sure that it's center. You can go ahead and put your head back down. Just making sure that there's no lumps or just making sure that it's center. Alright, so we're going to be doing a few other neurologic tests as well. Can I have you take your glasses off for me one more time? Alright, and I'm just going to check your pupils and make sure that they're round and equal and responsive to light, and that they also have accommodation, okay? So just go ahead and look at the wall behind me. Alright, I'm just going to shine this light in your eye. Alright, your pupils are responsive to light. Alright, I'm going to hold my finger about a foot away from your face, and then just stare at the wall out in the distance. And then when I say stare at my finger, you can just look at my finger, okay? So stare at the wall behind me, and now at my finger. Okay, and your pupils have accommodation as well, which is good. Alright. Could I have you stand up for me? Alright, I'm going to do a Romberg's test. This is just kind of for sense of balance. This would be inappropriate to do on a patient if the patient came in and they had some kind of ambulatory aid with them, if they recently had a seizure, if they had any kind of stroke, or if they had any kind of structural abnormalities with their ear canal, anything that would throw their balance off. But because she doesn't have a history of any of that, and she came in and her gait was fine, we can do this test. So I'm just going to have you close your eyes and stand on both your feet. And I'm just checking for swaying and any kind of balance issues. Alright. You try picking up one leg for me. Alright, go ahead and put that foot down. Alright, you can open your eyes again. Alright, go ahead and sit back up here for me. So no balance problems, which is good. Alright, so now I'm going to be testing some of your musculoskeletal, just like grip strength, and then also we're going to do some coordination as well. So I'm going to move my finger from side to side just very slowly, and I want you to take your finger and go from your nose to my finger. Okay? So go ahead. Okay. Alright, and we're going to do one more. I want you to put your arms out like this and just go from out here to your nose. Okay, that's good. Okay, now we're going to move to some of the grip strength. Go ahead and squeeze my hands. Alright, that's good. Good tight grip. Alright, and so go ahead and put your arms out like this again and try curling them up towards you. Alright, and then now try like extending them out and down. Push down. Alright, go ahead. One more time. Alright. Alright, now shrug your shoulders. Okay. And then turn against my hand, and then the other hand. Okay. Alright, now I want you to try bringing this knee to your chest. Alright. Other one. Alright. And then I want you to try, I want you to try kicking out. And I'm going to come down here. I go ahead, kick out. Pull in. Alright. Same thing with this leg. Kick out. pull in. Alright, and now just like with a car, like a gas pedal or a brake pedal, I want you to push down, right, and then pull up. Same thing with this one. Push down and pull up. Alright. Well, how tall are you?
5'7",
Okay, and you know how much you weigh?
130.
These are also things that I could be doing. I could have her height and weight prior to entering the room. Don't have a scale or any kind of measuring system available at this time, but that can be documented in the chart as well for height and weight. Okay, so we did your grip strength, we did your coordination, we did your neurologic, we did your strength testing. Right. Now we're going to be going to some of the cardiovascular portions of the exam. Wait, there's one more thing. Prior to moving on, we're just going to do a sensory perception, just testing a cranial nerve, just to make sure that you have all your sensing available. Do you ever get like tingling in your extremities or like numbness or tingling?
No.
Okay. Here I have a Q-tip. So this, you can feel that cotton swab, so that's going to be the soft, and then the other end is going to be the sharp. I just want you to close your eyes and then tell me if it's the sharp or soft, and then where it's touching, okay?
Soft and right arm. Sharp and left arm. Sharp and left hand. Soft and forehead. Soft and right leg. Sharp and left leg.
Alright, that checks out. Okay, so we're going to move on to the cardiovascular portion of the assessment. Is that alright?
Yes.
Alright. Do you have any history of, like, family history of heart attack?
No.
Stroke?
No.
Does anyone smoke in your family?
Yes.
Okay. Do you smoke?
No.
How often would you say that you're exposed to secondhand smoke?
Not very often.
Okay. Do you have any like heart palpitations?
No.
Okay. Also, when I was down here, just observing like your pedal pulses, there's no swelling, and so there's no edema. So there's no need for any kind of compression socks. I don't see circulation being an issue for you. I'm just going to be listening to your heart, and going to be listening for any murmurs, any kind of abnormal beat. Is that right?
Mm-hmm.
Okay. So just go ahead and relax. I'm going to listen to with the diaphragm and the bell, I'm just going to listen to the 5 landmarks of the heart, listen to a full love dub, and then we're going to move on to respiratory. Okay?
Mm-hmm.
All right. So I'm just filling here for your second intercostal space. I'm going to start up here at your aortic. Pulmonic. Pulmonary. We go to Erb's point. Tricuspid. And then mitral. We're just going to repeat that one more time, but I'm going to use the bell. Alright, everything sounds normal. Nothing doesn't sound like you have any murmurs or regular heartbeat. Do you drink caffeine at all?
Yes.
You do? How many, do you drink coffee or do you drink soda?
Coffee.
Okay. How many cups a day would you say you drink?
2 to 3 in the morning.
Does that interrupt your sleep at all?
No.
Your sleep cycles? Okay. How do you sleep normally?
Oh,
Sleep
good.
well?
Yeah.
About how many hours a night would you say you get of sleep?
About 7.
About 7?
Mhm.
Alright, well that's good. Yeah, if there was anything that was interfering with sleep, caffeine would be one thing that could definitely interfere, or if you're feeling any kind of heart palpitations or like irregular beats, people that drink too much caffeine, definitely one thing to moderate. Do you drink at all?
I mean, yeah.
Has anyone ever asked you to cut back on drinking?
No.
About how many drinks a week would you say you have?
Maybe 1 or 2.
Okay, alright. That could be another thing too that might also influence heart rate or heart rhythm. So now I'm just going to be listening to your apical pulse, and I'm going to be feeling for any pulse discrepancies between like your beat here and then also on your radial pulse, okay?
Mhm.
Alright. So I'm just going to feel your radial pulse here. Alright, and there's no discrepancies in your pulse, so everything feels like circulation is fully intact. There's nothing that is a red flag to me. Alright, so now I'm going to be moving on to the respiratory portion. Sound good to you? Alright. Do you use an inhaler?
No.
I can't remember if I had asked you that before for the
No.
seasonal allergies.
Nope.
Okay, and you didn't come in with any kind of mask? No breather mask? You don't have any nasal cannula? Yes or no?
No.
Alright. So I'm just going to be listening to your lung fields. I'm going to listen to 6 different spots on your front, and then I'm going to have you stand up, and then I'll listen to 8 different spots on your back. Is that alright?
Mhm. Yes.
Alright. Come over on this side. And if you get lightheaded, just let me know. And I'll have you just take a deep breath in, and then a deep breath out, and then I'll move to the next spot. Okay?
Mhm.
Alright, go ahead. Deep breath in. Alright. Deep breath in. Deep breath in. Deep breath in. And I'm going to come down on this side here. Deep breath in. Deep breath in. Alright. I don't hear any crackling or gurgling. It doesn't sound like there's any kind of fluid build up in your lungs. So go ahead and stand up for me. And if you would face that wall, or actually go ahead and face this wall. And I'm going to listen to 8 different landmarks on your back, alright?
Mhm.
Alright, so take a deep breath in. Deep breath in. Alright. Alright, you can sit back down. I'm going to make a quick note. I did accidentally listen to 2 spots over the scapula on the back. You want to try avoiding that so that way you can hear full, or you can have a fully auditory or audible auscultation of the lung fields in the back. One other thing, so with COVID-19 going around, this could be pertinent if you ever are infected and you're in the hospital in recovery, or if either post-surgical or if we're trying to prevent pneumonia. So I don't have an incentive spirometer, but I do have a printout here, and I'm just going to show you. So what an incentive spirometer is you have a mouthpiece here, then you have a diaphragm, and then you have this ball that's here, and then you have these 2 ideal markers. And so what you do is about 5 to 10 times an hour, where you will end up doing, or if you ever need this, especially if you're trying to prevent fluid buildup in the lungs, is you take a deep breath in with your mouth on the mouthpiece. You want to hold that breath for 2 to 5 seconds. You want to slowly exhale, and you're going to see this piston rise up, and you want to try getting this to rise up at a steady pace, and then keeping this in the ideal, in this ideal range. And so then you could take a break, and then you repeat again, like I said, 5 to 10 times an hour, and that'll really help with making sure that your lungs aren't losing any kind of additional lung capacity and that there's no fluid buildup. So if it ever comes to that and you ever do get COVID-19, that's one thing that you could use. All right, so we did the cardiovascular, we did some respiratory. We're going to move to the GI and the GU portion of the assessment. Is there any other questions moving forward?
No.
Okay. So moving on with the GI, when was the last time you had a bowel movement?
Today.
Okay. Would you say that you have like a pretty regular schedule of avoiding your bowel? Or?
Yes.
Okay. No troubles?
No.
Okay. No pain?
No
Like
pain.
constipation?
No.
Is there any kind of special diet that you have?
No.
Okay. And no kind of like other medications that you take?
No.
All right. What we're going to be doing is I'm going to listen to, and you don't have any kind of current discomfort in your stomach?
No.
Okay. So I'm going to be listening to your different fields like on your stomach and different regions of your stomach. And I'm just going to be listening for either a hypo or a hyperactive stomach. You listen to some stomach sounds, and like you said, you're not having any troubles going to the bathroom, so I don't suspect to find anything abnormal. So I'll just have you lay back, and being on the right hand side, I can observe contour, and I can also observe that there's no any kind of masses, there's no lesions, and given that she's slender, she's still in a healthy BMI range, but if there was a patient who is more slender or underweight, I'd also want to be checking for any visible peristalsis. That'd be a big no-no, but I don't see that being a problem with you because you're still within healthy range. Alright, so I'm just going to listen, and then I'm going to gently palpate, okay?
Mm-hmm.
Alright. Alright, I'm going to start this about here, right lower quadrant. Have you had anything to eat recently?
Yes.
Okay. Alright. So it sounds hyperactive right now, but that's normal given that you've just recently eaten. And now I'm just going to be gently palpating using just a few, these 3 fingers, and just let me know if there's any pain or discomfort, okay?
Mm-hmm.
I'm just checking for any kind of lumps or any kind of firmness. I'm checking for some stomach distension, but again, normally there's other signs and symptoms with that. Alright, so everything checks out. Go ahead and sit up for me. One other thing I would do is with a patient, just for this video, obviously I'm letting her keep her shirt on, but with a patient you have a gown, and then you could either lift the gown, and you want to be giving privacy as well. Same thing with auscultating for heart sounds and lung sounds, just going under the gown. You don't want to be over the gown. And then also, she had said that she had previously eaten. It's pertinent for the temperature. I'd ask you if you had anything to eat or drink in the last half hour. And then if she had, I would have waited a little bit longer to take the temperature. But just for the sake of this video, still taking the temperature. Temperature's in normal range. Alright, and moving on to the GU assessment. So when was the last time you voided your bladder?
A few hours ago.
Okay. And about how many times would you say you have to go number 1 in a day?
6 or more.
Okay. You're not having to go more than like once every 2 hours, are you?
No.
Okay. Is there any pain when you urinate?
No.
Any foul odors or any kind of strange coloration to your urine?
No.
All right. Is there any kind of family history of like kidney disease?
No.
All right. All right. Is there any other questions that you have for me?
No.
All right. If you do have questions, though, you can always ask your doctor when he comes in. Thanks for coming in today, and then thanks for working with me on this head-to-toe assessment. And then when I'm leaving the room, I would certainly leave the call light next to you if she wanted to get a hold of anyone prior to, especially if the patient is more elderly, and they have troubles ambulating. You want to make sure that they're left in a safe environment, and you don't want to be leaving supplies out or anything that could be of health hazard. So, I wash my hands and I would thank the patient. I would leave the room and provide privacy. And that's about it.